Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to drive better patient outcomes. This is episode 9 of our 10-part series on case management, and today, we are exploring a game-changing question. Are you using data to improve patient care, or are you just guessing? In today's fast-paced healthcare environment, case management should not be based on assumptions. Real patient data should drive it. But nurses and healthcare teams often lack the tools, training, or time to use data effectively. What if we told you that using data strategically could help anticipate patient needs, improve workflows, and reduce hospital inefficiencies? The truth is that data is one of the most powerful tools in case management. When used correctly, it can predict complications, streamline care transitions, and enhance patient safety. The challenge is knowing how to collect, interpret, and apply this data in real time. In this episode, our hosts, James Carter, BSN, RN, an ICU nurse, and Emily Ramirez, MSN, RN, a nurse manager, will break down how data-driven case management can improve patient outcomes and hospital efficiency. Why nurses should use patient metrics to identify trends and anticipate needs. The role of electronic health records, EHRs, and analytics tools in case management. How data-driven strategies help reduce readmissions and improve workflow efficiency. They will also share insights from Dr. Nicholas Abella's article, which highlights how nurses can take the lead in using data to drive better patient care. And as always, we will leave you with an actionable takeaway. Pilot a program where one patient per shift is closely monitored using key data metrics to enhance care planning and decision-making. It is time to stop guessing and start leading. Let's explore how data can transform case management and patient care.
Hey everybody, and welcome back to the Healthcare Nurses Network podcast. We're all about giving you the tools and knowledge to really make a difference, right?
Absolutely.
Well, today we're diving deep into something that's totally changing how we think about case management.
Ooh, exciting.
It is data. Bet you're on the edge of your seats for this one.
Always. Data-driven healthcare, it's the future, and it's not going anywhere.
And for good reason. We're talking about using information to get better results, make things run smoother, and most importantly, give our patients the best possible care.
That's what it's all about.
So get ready to say goodbye to guesswork.
All right.
Because we're entering the world of informed decisions backed by real, concrete data.
Love it.
This deep dive is going to take us on a journey through how data is transforming case management from the top,
the big picture,
all the way to the bedside. And leading the way is an article called Stop Guessing, Start Leading by Dr. Nicholas Abella.
He's the founder and CIO of Healthcare Nurses Network and a real trailblazer in this field.
So let's jump right in. Dr. Abella makes a really strong point that data-driven healthcare isn't a nice-to-have anymore. It's a must-have.
Yeah, think about it. For years, healthcare has relied on subjective stuff, observations, gut feelings.
Right.
But data brings a whole new level of clarity and insight. It's like finally having the full picture.
It's like trading in a fuzzy old map.
For a GPS.
Exactly. With data, we can see trends and make proactive decisions that actually have a real impact on patient care.
And that's what we want, right? To be ahead of the curve.
Absolutely. So how does all this theory actually work in the real world?
Good question.
What does data-driven case management look like for nurses on the ground?
It's beneficial for everyone. Let's start with nurse leaders. They can use those data dashboards to track important stuff like how long patients stay and readmission rates.
Yeah, it's so valuable. Imagine being able to zero in on areas that need work and making the most of your resources, all thanks to data insights.
You got it. Now let's move to the bedside nurses. They're using electronic health records and real-time data to catch potential issues early on.
So before they even become a problem.
Exactly. Imagine a nurse keeping an eye on a patient's vitals and lab results through a wearable. If they see something off, they can flag it right away, maybe even preventing a serious complication.
Like a superhero early warning system.
That's a good way to put it. But it's not just reacting to immediate problems. Data can also help us identify patients at higher risk for readmission or complications.
Okay.
By analyzing data on previous hospital stays, social determinants of health, and how well patients stick to their medication plans,
Right.
Nurses can create really personalized care plans that meet each patient's unique needs and challenges.
This is crucial, especially for patients juggling multiple chronic conditions. It's about looking at the whole picture, not just treating symptoms in isolation.
You got it.
We're talking about a continuous care plan that supports patients throughout their health journey, both inside and outside the hospital.
Exactly. Creating that safety net.
And that's where I think data shines. It connects the dots, helps us see the big picture, understand all the factors that influence a patient's health.
And helps us move away from a one-size-fits-all approach.
Yes, it's about providing truly personalized care, tailored to each individual.
I couldn't agree more. Now, before we jump into a real-world example of how this all works in action, I want to remind everyone about all the awesome resources at healthcarenurses.net.
Yes, seriously, you'll find a goldmine of information there.
We've got a case management checklist for nurses, info on TJC and CMS standards, and a whole lot more.
It's like a one-stop shop for nurses who want to make data-driven strategies a reality.
Exactly.
All right, back to the power of data in action. Dr. Abella shares this amazing story about a patient discharged after being treated for multiple chronic conditions.
Oh, this is a good one.
Using data on her readmission history, social determinants of health and medication adherence,
Okay.
nurses were able to spot potential problems before they even popped up.
Being proactive.
They linked her up with community resources, made sure she had transportation to follow-up appointments, and provided support to help her manage her meds.
It's a perfect example of moving from a reactive, oh no, something's wrong approach to a proactive, let's get ahead of this one.
Anticipating needs and intervening before it turns into a crisis. That's what data-driven case management is all about.
Right on. By using data strategically, we're talking about efficient, effective, and patient-centered care.
Now, I know what some of you might be thinking. This all sounds great, but where do I even start? It can be a little overwhelming.
He can for sure.
But don't worry. Dr. Abella lays out a super practical 3-step plan.
3 steps to success.
Gather key metrics, use dashboards, and make data review part of your daily routine.
Simple as that.
So first things first, what are the key metrics that really matter for your patients?
Exactly.
This might include things like readmission rates, how well chronic diseases are being managed, or patient satisfaction scores.
Focus on the data that's most relevant to your patient's needs and goals.
Once you've got those key metrics, you can start tracking them and looking for trends. And that's where dashboards come in.
Dashboards, they make data so much easier to understand, and they can help you spot areas where you need to intervene.
They also help track your progress over time and see if your interventions are making a difference.
They're like little progress reports.
Dr. Abella also stresses how important it is to make data review a habit.
Yeah, weave it into your daily routine.
Whether it's during morning rounds, team huddles, or individual assessments, taking a few minutes to check key data can help you stay ahead of potential problems.
Stay one step ahead.
So make data-driven decision-making a seamless part of your workflow. And remember, you don't need fancy tech to get started. Even basic data points can provide valuable insights.
You don't have to go all out right away. Start simple.
That's a relief. And what about the time crunch? I know a lot of nurses are thinking, we're already swamped. How are we supposed to add data gathering and analysis to our already packed schedules?
I hear that a lot. But Dr. Abella makes a good point. Using data actually saves time in the long run.
Really? How so?
By preventing complications, cutting down on readmissions, and streamlining processes, you're freeing up more time to focus on providing that top-notch patient care.
So it's about working smarter, not harder. Using data to be more efficient and effective in everything you do.
Exactly. Data can help you identify those bottlenecks, streamline workflows, and use your resources wisely. By tapping into the power of data, you can actually create more time in your day, not less.
Sounds like a win-win to me.
It is.
Now, I know this is a lot to take in. We've covered so much today. But before we move on to the next part of our deep dive, where we'll be exploring the ethical side of using data,
Very important.
I just want to remind everyone to check out healthcarenurses.net. You'll find a treasure trove of resources there,
We've got you covered.
including a case management checklist for nurses' info on TJC and CMS standards, and a whole lot more. It's a phenomenal resource for any nurse looking to put data-driven strategies into practice.
Apps.
All right, let's dive into those ethical considerations.
Let's do it. Data privacy is a big one.
Huge. We have a duty to protect our patients' sensitive information and use data in a way that respects their privacy and confidentiality.
Dr. Abella gets into that in his article. He makes it clear that data-driven care should never come at the cost of patient privacy. It's not about gathering data just for the sake of it. It's about using it responsibly and thoughtfully to improve patient outcomes.
And he also talks about transparency. Patients should know how their data is being used and have the option to opt out if they have concerns.
Right, building trust is key, and being transparent is how you do it. We got to be upfront about why we're collecting data, how we're using it, and what safeguards are in place to protect their privacy.
It's not just about protecting privacy, it's also about security, making sure we have strong systems to prevent data breaches and unauthorized access.
Cybersecurity is more important than ever, especially with how much we rely on technology and data these days. We need those strong firewalls, encryption, and regular security audits to keep patient information safe.
No doubt, it's a huge responsibility, but one we absolutely can't afford to take lightly.
Absolutely. Now let's shift gears for a bit and talk about data storytelling. Dr. Abella makes this point that data isn't just numbers, it tells a story.
I love that idea.
Yeah.
It brings a human element to data, reminds us that there's a person with a story behind every data point.
Exactly. Data can help us understand the challenges and triumphs of each patient's health journey. It can uncover patterns and insights we might miss otherwise.
But how do we make sure those data narratives don't overshadow individual needs or lead to biased care?
That's where critical thinking comes in. Data is a powerful tool, but it's only as good as the people using it. We have to be aware of our own biases and assumptions and always prioritize the needs of each individual patient.
So data informs our decisions, it doesn't dictate them.
Exactly. It's a guide, not a rulebook. It's about using data to enhance our clinical judgment, not replace it.
I know this is a lot to process. We've covered a ton today, from the benefits of data-driven care to the ethical considerations and the importance of data storytelling.
It's complex, but super important for nurses to understand. The future of healthcare is data-driven, and we got to be ready for it.
And that's where healthcarenurses.net comes in. They have a wealth of resources to help nurses navigate this new world.
We've got your back.
We're talking about a case management checklist for nurses info on TJC and CMS standards, and so much more.
It's a fantastic resource for nurses at all levels, whether you're just dipping your toes into data-driven care or you're already knee-deep in implementing these strategies.
And speaking of implementation, Dr. Abella has a specific suggestion for nurse leaders.
Ooh, what's that?
Pilot a program where one patient per shift is closely monitored using key data metrics.
Love it.
The idea is to track the impact on patient outcomes and how efficiently care is delivered over 3 months.
It's a practical way to see the benefits of data-driven case management in action. Start small, gather evidence, and build a case for rolling it out more broadly.
Makes sense. It gives nurses a chance to test the waters in a controlled environment and really demonstrate the value of this approach. Now, before we wrap up this part of our deep dive, I want to address the elephant in the room time.
Oh yeah, that comes up a lot.
I know a lot of you are thinking, we're already stretched thin. How are we supposed to find time to gather data, analyze it, and fit it into our crazy schedules?
A valid concern for sure. But Dr. Bella argues that in the long run, using data actually saves time.
Really?
By preventing complications, reducing those readmissions, and streamlining care processes, you free up more time to focus on what matters most, providing excellent patient care.
So it's about working smarter, not harder, using data to be more efficient and effective in everything we do.
Absolutely. Data can help you pinpoint those bottlenecks, streamline those workflows, and optimize your resources. By harnessing the power of data, you can actually create more time in your day, not less.
Sign me up.
Me too.
Now, I know change can be tough.
It can, but it's also a chance to grow.
Dr. Abella encourages us to embrace the learning process.
Don't be afraid to try new things, ask questions, and lean on your colleagues for support.
We're all in this together. And the more we learn about data-driven care, the better equipped we'll be to provide the best possible care for our patients.
Absolutely.
So let's step into the future of healthcare together.
Let's do it.
Let's embrace the power of data and use it to transform how we approach case management.
It's about moving from reacting to problems to preventing them from happening in the first place.
From relying on gut feelings to making informed decisions based on solid evidence.
And empowering nurses to be true leaders in patient care.
And don't forget, data isn't just about numbers, it's about people.
It's about using data to understand each patient's unique health journey and guide them toward better outcomes.
It's about making healthcare more personalized, more effective, and more compassionate.
I like that, more compassionate.
So to all the amazing nurses out there on the front lines of healthcare, I encourage you to embrace the power of data.
It's a game changer.
Start small, ask questions, and don't be afraid to experiment. You don't need to be a data whiz to make a difference.
Not at all.
Just be curious, committed, and ready to learn. And as always, we're here to support you every step of the way. Head over to healthcarenurses.net for a ton of resources, including a case management checklist for nurses, info on TJC and CMS standards related to case management, and so much more.
It's a treasure trove of helpful information.
And that wraps up part 1 of our deep dive into data-driven case management.
Stay tuned for part 2, where we'll be talking about data privacy, data security, and data storytelling.
We'll see you then.
Bye for now. So let's dive into those ethical considerations like we promised.
Yes, data privacy is a big one. We have a responsibility to protect our patients' information and make sure we're using data in a way that respects their privacy.
Absolutely. Dr. Abella really emphasizes that in his article, data-driven care should never compromise patient privacy. It's not about collecting data just to have it. It's about using it thoughtfully to improve patient outcomes.
He also talks about transparency. Patients should know how their data is being used and be able to opt out if they're not comfortable.
Yeah, that's so important for building trust. We need to be upfront about why we collect data, how we use it, and what safeguards are in place to protect their privacy.
And it's not just about protecting privacy, it's about security too. Making sure our systems are strong enough to prevent data breaches and unauthorized access.
Right. Cybersecurity is crucial these days with all the technology and data we use in healthcare. We need strong firewalls, encryption, and regular security checks to keep patient information safe.
It's a big responsibility, but we can't take it lightly.
Absolutely not. Now let's switch gears a bit and talk about data storytelling. Dr. Abella highlights that data isn't just about numbers, it's about telling a story.
I love that it makes data feel more human, reminds us that there's a person behind every data point.
Exactly. Data can help us understand each patient's journey, their challenges and triumphs, and it can reveal patterns we might otherwise miss.
But how do we make sure those data stories don't overshadow individual patient needs or lead to biased care?
That's where critical thinking comes in. Data is a powerful tool, but it's only as good as the people using it. We need to be aware of our own biases and always put the individual needs of our patients first.
So data helps guide our decisions,
Yeah.
but it doesn't make them for us.
Exactly. It's a guide, not a rule book. We use it to enhance our clinical judgment, not replace it.
I know this is a lot to absorb, but it's important stuff. We've covered so much about data-driven care, the benefits, the ethics, the power of storytelling.
It's complex but essential for nurses to understand because the future of healthcare is data-driven. We need to be ready.
And that's where healthcarenurses.net comes in. They have tons of resources to help nurses navigate this new landscape.
We've got you covered.
From a case management checklist to info on TJC and CMS standards and a whole lot more.
It's a great resource for nurses at all levels, whether you're just starting out with data-driven care or you're already a pro.
Speaking of putting this into practice, Dr. Abella suggests a really cool idea for nurse leaders.
Oh, I like where this is going.
He recommends piloting a program where one patient per shift is closely monitored using key data metrics.
I love that.
The goal is to see how this affects patient outcomes and care efficiency over a 3-month period.
It's a hands-on way to see the benefits of data-driven case management firsthand. Start small, gather some evidence, and build a case for making it a standard practice.
It's a great suggestion. It
Yeah.
gives nurses a chance to test the waters in a controlled way and really prove the value of this approach.
Exactly. Show, don't tell.
Now, I know a lot of you are probably thinking about the time commitment.
Or time is always a factor.
You're already busy.
Sure.
How can you possibly squeeze in data gathering, analysis, and integration into your packed schedule?
It's a valid concern, but Dr. Abella argues that using data actually saves time in the long run.
Interesting. How does that work?
Think about it. By preventing complications, reducing readmissions, and streamlining processes, you free up more time to focus on what really matters, providing excellent patient care.
It's about working smarter, not harder. Using data to become more efficient and effective.
Exactly. Data can help you identify bottlenecks, streamline workflows, and make the most of your resources. You're basically creating more time in your day.
I like the sound of that. So it's about making our work more meaningful and impactful.
It is.
Dr. Abella encourages us to embrace the learning process.
Be open to new approaches, ask questions, and don't hesitate to reach out to colleagues for support.
We're all in this together, and the more we learn about data-driven care, the better equipped we'll be to provide the best possible care to our patients.
Couldn't have said it better myself.
So let's step into the future of healthcare.
I'm ready when you are.
Let's embrace the power of data and use it to transform how we approach case management.
It's about shifting from reacting to problems to preventing them.
From relying on gut feelings to making informed decisions based on evidence.
And empowering nurses to be true leaders in patient care.
And remember, data isn't just about numbers, it's about people.
It's about using data to understand each patient's unique journey and guide them toward better outcomes.
It's about making healthcare more personalized, more effective, and more compassionate.
That's a beautiful way to put it.
To all the amazing nurses out there, we encourage you to embrace the power of data.
It can truly change the game.
Start small, ask questions, experiment. You don't need to be a data expert to make a difference,
Nope, just be curious, committed, and open to learning.
and we're here to support you every step of the way. Don't forget to visit healthcarenurses.net for a wealth of resources, including a case management checklist for nurses, info on TJC and CMS standards related to case management, and so much more.
It's all there waiting for you, and it can make healthcare more compassionate too.
I love that. More compassionate. So to all you incredible nurses out there, I encourage you to really embrace the power of data.
It can really make a difference.
Start small. Ask questions. Don't be afraid to try new things. You don't have to be a data scientist to make a real impact.
Not at all.
Just be curious, committed, and willing to learn. And as always, we're here to support you every step of the way.
That's right.
Be sure to visit healthcarenurses.net for a ton of helpful resources.
Oh yeah, we've got a case management checklist for nurses, info on TJC and CMS standards related to case management, and a whole lot more.
Seriously, it's a goldmine of information.
It is.
And that wraps up our deep dive into data-driven case management.
We hope you found it insightful.
We sure did.
Remember, data is a powerful tool,
It is.
but it's up to us to use it wisely and ethically to improve patient care.
Exactly.
Thank you for tuning in to the Healthcare Nurses Network podcast.